audience. Okay, so my name is Mackenzie, and today we're going to be talking about the positive and negative effects of Adderall. The specific purpose of this is to inform my audience of the benefits, short-term risk, and long-term risk of taking Adderall. The central idea is that you should not take Adderall unless you are prescribed or have a medical diagnosis. So let's say, for example, you're in the library and it's already 8 o'clock at night and you've been studying all day. You've been trying to study, but nothing seems to really stick, and you're extremely frustrated and tired. You can't focus, you're on Instagram every 5 minutes, and you check your phone every single time it lights up. You explain your frustration to a friend that you're texting, and they say they have the perfect thing for you. They come to the library and they say, "It's just an Adderall." You'll stay up all night and you'll ace your test at first thing in the morning. Trust me. Think about it for a second. What would you do in this situation? Now, after hearing that, let's look at the medical advantages of taking the Adderall. The medical advantages of the new age medications has revolutionized modern life. The increasing knowledge and better use of medicine has increased the life expectancy of the average person. Vaccines are given to babies to prevent disease such as smallpox or measles, and many physical diseases are being treated through modern medicine. Now, the medical world is focusing on treatment of mental illnesses, such as bipolar disorder, depression disorder, attention deficit disorder, which is also known as ADD, and attention deficit hyperactivity disorder, which is ADHD. In America, nearly 11% of children from ages 4 to 16 are diagnosed with ADHD or some other form of attention deficit disorder. According to the Scientific Review of Mental Health Practice, there's evidence of substantial ADHD overdiagnosis. So most children are taking the medicine to help stabilize an illness that they don't even have. These children are taking mood-altering drugs for no other reason other than just being an extremely active child. These drugs, such as Adderall, have not been around for long enough to see the long-term effects they may have on children or even adults. While this medication was first made for children, over the years it has become exceptionally abused by college-age adults. In college, it is always a struggle to make the grades that we want. Many people are aspiring to go on to higher level education, such as med school, law school, or anything else that may require a graduate degree. This places us on an extremely high level of stress and can be extremely frustrating whenever you stay up all night and study all week and still manage to make a C. Other college students may find it extremely difficult to find the ability to focus throughout the week. In these situations, many people look for an easy out. Today, that easy out is a common drug that's known as Adderall. It has been also helpful to be used for people who have narcolepsy, which is a sleeping disease. But it's most often used for ADHD and ADD. It has now been found to be helpful in improving memory and focus. It also decreases the need for sleep and is extremely popular in all college communities. It's amazing to learn how Adderall works inside of the body. Adderall, also known as amphetamines, works by releasing dopamine from the reward system of the nucleus accumbens of the limbic system. Therefore, people use Adderall for reasons that are not medical may experience a somewhat euphoric effect. Pursuing an Adderall high is obviously what tends to start the initial addiction of amphetamines. There are both positive and negative effects of Adderall. The positive effects are not talked about nearly as much as the negative effects, but the positive effects of Adderall are increasing increasing the attention span and improving memory. These benefits are mainly used to decrease the symptoms of ADD and ADHD. It provides a person with a more effective and functional train of thought. It works by energizing the person taking it. The energizing effect is often used in a person who has narcolepsy, which is a sleeping disease. So basically, the person is extremely drowsy. So if they take the Adderall, it'll give them a boost of energy to where they won't be as drowsy throughout the day. The college student who needs to study all night for an 8 o'clock midterm may look at this as the perfect easy out drug. Though this magical drug seems to have many benefits, there are also many risks that accompany it. The risks that accompany this drug are decrease in appetite, sleep problems, weight loss, irritability, and upset stomach. This medicine has been known to suppress the appetite so significantly that people have been known to lose up to 10 pounds in 1 month. It is important in taking the stimulant to eat at least 3 meals a day, even if you're not hungry, and to drink plenty of water. While one of the positive effects is increased energy, one of the negative effects is insomnia. So you may take the medication and not be able to sleep for several days at a time, or not be able to sleep for up to a week. And usually this medication can give you a euphoric mood whenever you first take it, but once the medication starts to wear off, you will become extremely irritable, and you can even get a headache that won't be relieved by ibuprofen or Tylenol. Although the elevated mood or excessive energy wasn't among the most frequently reported side effects, it is more commonly reported by parents whose children were taking amphetamines. While there are many short-term risks of taking this medication, few people know of the long-term risk because it is such a new drug that not all of the long-term risks are known just yet. So while it's difficult to know the long-term effects of taking this stimulant, we are aware of the few effects that are noticed. Since the medication releases an outpour of dopamine, it increases the heart rate so fast, which can lead to palpitations. Long-term use can lead to heart disease, or heart failure, or even a heart attack. Since it's a neurologic drug, it also affects the brain and all of its components, which can lead to hallucinations or even tremors with extended use. Long-term effects are also seen when mixing the use of Adderall and alcohol or other drugs. If you take it while you're taking alcohol, it can lead to alcohol toxicity, and if you take it while drinking caffeine, it can lead to increased heart problems or increased blood pressure, which can cause longer problems in the end. As you can see, taking a stimulant does not come without costs. In conclusion, this short speech should have shown you the importance of not taking Adderall if you're not prescribed for it. The risks outweigh the benefits, and it should be considered very deeply before taking any sort of stimulant. Now let's go back to the scenario I mentioned before. With the knowledge that you have gained from this speech, you would know that taking Adderall from your friend who so graciously provided to you would be a big deal. You should now know that it's not worth the benefit of possibly receiving a grade, and you should know that saying no is probably the best choice. And my audience is still here. And my visual aid today is going to be Bailey because she's on Adderall and she's extremely focused.